So hello everyone, get ready to learn the 206 bones in our human body together in one go. So first, the frontal, the parietal, temporal, occipital, ethmoid, sphenoid. Then comes the fascia, the unpaired one, vomer and mandible. They are unpaired. The paired one is maxilla, zygomatic, this lacrimal, this nasal, inferior nasal concha, and here is palatine, which divides oral cavity and nasal cavity. After skull, we have vertebrae. This is our lower part of the skull, the occiput. Upper 7 vertebrae are cervical vertebrae. Next to cervical, there are 12 thoracic vertebrae, which articulates with ribs. These articulating process articulates with ribs, and then the lumbar part, the body of lumbar is very wide as compared to other vertebrae. There are 5 lumbar vertebrae. This is our sacrum, the bone, and cortex. This is the disarticulated version of our vertebrae. Others are true vertebrae except these two. These two are the false as they fuse together in one bone. This is the hyoid bone. This is the floating bone. It holds the larynx, the 3 auditory ossicles, incus, malleus, and stapes. And this bone in the front of chest cavity is sternum. This is the manubrium, the body, and the xiphoid process. The ribs, these upper are the true ribs, articulate anterior with sternum and posterior with thoracic cavity. These lower three are the false ribs, articulate with 7th rib and posteriorly with thoracic. 4 floating ribs, 2 each sides. These floating ribs posteriorly articulate with thoracic, and anteriorly they do not articulate anywhere, they just float. That's why they are floating. Front, we have clavicle, a beauty bone. This is gender specific. On posterior, we have shoulder blade called as scapula. The glenoid process of the scapula articulates with the head of humerus, longest bone of our upper arm called as humerus. Next to the humerus, medially we have ulna, and laterally we have radius, as the disc-shaped head of the radius make it very special. These tiny bones are the scaphoid, lunate, tricunteral, pisiform, trapezium, trapezoid, capate, and hamate. We have 5 metacarpals, 5 on one palm and the 5 on another. Then the phalanges. These tiny phalanges, these are the proximal phalanx and these are the distal phalanx. Then next to that we have our pelvis. This is also gender specific and a very irregular bone. Posteriorly it articulates with sacrum and anteriorly it articulates with pubis. This cartilage is pubic symphysis. This is the upper part of pelvis is called as ilium. Lower part is called as ischium, and anterior-inferior part is called as pubis. Our pelvis gives articulation to our femur bone, the longest bone of the human body. So this is our anterior surface femur. This sesamoid bone is known as patella, situated anterior to the knee joint. This broad bone on the leg is our tibia. Lateral to that is our fibula situated, and then we have our tarsals. Uppermost tarsal is talus. Calcaneum is navicular, the cuboid, and 3 cuneiforms. This is lateral cuneiform, intermediate cuneiform, and medial cuneiform. Next to the tarsal, we have metatarsal, 5 on one side and 5 on the another. Then we have our phalanges, proximal phalanx and distal phalanx, total 28 phalanx.